Hello, and welcome to our first podcast looking at our LIC students and the primary care and population medicine program. My name is Dr. Meghan Geary. I direct the longitudinal integrated clerkship at the Warren Alpert Medical School at Brown University. Today, we're talking about what my LIC student can help with. As a preceptor in the longitudinal integrated clerkship, or LIC, you are aware of the tremendous help your student is in clinic with patient care. However, are you also aware that your student can help with the social determinants of health, such as housing, food insecurity, navigating the healthcare system, and many other social aspects? All of the LIC students are in a 4-year primary care and population medicine program. In year 1 of this PCPM program, students participate in the Rhode Island Navigation Partnership Program and are partnered with a community-based organization and practitioners in Rhode Island. Through this program, students and case managers act as healthcare navigators and medical advocates for partnered participants, all of whom experience barriers to accessing healthcare and social services. This navigation support includes scheduling and attending medical appointments, improving communication among providers, assisting with healthcare system literacy, facilitating Social Security income benefits, helping to secure housing opportunities, providing social support, and more. Last year, an additional component was added, which brought Rhode Island social work students into the fold, where they too are part of this partnered participation with a patient. Additionally, as part of the PCPM program, students learn about social determinants of health during the 4-year health system science courses they are enrolled in. During HSS 1 and 2, students focus specifically on topics such as healthcare financing, healthcare disparities, racism in medicine, social determinants of health, patient safety, quality improvement, and medical legal partnerships. So what do students learn in all of these courses that will help your patients in clinic? With us today is Dr. Meghan Smith, a social work professor who co-leads Health System Sciences 1. Dr. Smith also co-leads the Navigation Partnership Program with Corinne Carbuccia, who is a community health worker and doula. Welcome, Dr. Smith. Is it okay if we use Meghan for this podcast?
Please do. Glad to be here with you.
Excellent. Our first question is, what will our PCPM students learn during Health System Science 1 and the navigation program?
Yeah. So starting out with a big question there. So for Health System Science 1, it's a first-year course. So we're keenly aware that our students are coming in with a really broad range of familiarity with these concepts. And generally speaking, the PCPM cohort comes in with a lot more context than some of their peers. And so it's really an opportunity to put together some standard language and then build upon that language, looking at what are the systems of healthcare, what does it look like to engage with concepts of race and racism in medicine, and how do we care for vulnerabilized and marginalized populations. And part of that occurs through large group sessions, primarily put forward by topic experts in all of these content areas. From a variety of disciplines. And then we also have small group sessions where the students are invited to really dive in a lot more deeply on some of these foundational concepts. And then the Navigation Partnership Program is a complement to that in a lot of ways, and that it gives the students an opportunity to put some of this into practice experientially and longitudinally in the community. So Corinne and I partner each student with what we call a partner participant, which is our intentionally sort of demedicalized term for a patient or a client. And that PCPM student, in conjunction with a Master of Social Work student, together co-navigate with someone who is experiencing barriers to accessing healthcare and social services throughout the course of the academic year. And those partner participants come from a range of community organizations and individual providers, and we match them based on the student's area of interest and the partner participants' needs. So students come in with a range of interests, everything from working with people experiencing homelessness to people who are new Americans or immigrants, refugees, asylees, to folks who have intellectual or cognitive disabilities, any other number of sort of structural vulnerabilities that impede their ability to access healthcare and social services in many cases. And so again, it's a way to bring those foundational concepts that they're learning in health system science to really see how that plays out in the life of an individual person, and to really learn from that person as the expert in their own lived experience, and also in how they're attempting to address their needs and goals related to healthcare and social services.
It sounds like it's really creating a team to sort of surround or support that partnered participant. And I know I've benefited from that experience as a primary care physician, having patients who have partnered students, and think that that brings so much experience when students enter their first clinical year in the longitudinal integrated clerkship, and how to partner with a patient or participant. What tools, excuse me, do students learn that may help LIC preceptors in their practice, thinking about when your students are in their first clinical year as third years?
Mhm. So in my experience, it really has kind of two axes to it. On the one hand, students are learning a lot of the mechanics of what it looks like to coordinate patient care. So learning, for example, how to navigate our many, frankly, Byzantine bureaucracies. What does it look like to navigate someone's health insurance, to get prior authorization, to get prescriptions approved? What does it look like to get a specialist referral? What does it look like to access foundational human services resources, navigating the Department of Health and Human Service to access SNAP or food stamp benefits, to get Medicaid if someone does not yet have public health insurance? Um, and then on the other hand, the core of the program is really the relational piece, is really exploring what it means to build a relationship with someone and to sustain that relationship across time. And that to us is really the heart and the soul of the program. And it's at its core, the reason why this program came to be is to really give students some protected time, space, and scaffolding to build a robust relationship with someone, and to learn from that person. And that's something that the students are expected to do as part of the program through their first year of medical school, but that many students opt in to carry forward through second, third, and fourth year, and in some cases even beyond that.
And I think you alluded to this. What impact do you think this partnership program has on future clinical practice, either for medical students or social work students?
It's a great question. And I think, again, so much of our education, both educations, both medical education and social work education, can kind of lean toward the technocratic at times. And of course, it's very, 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 very important to know those foundational skills and concepts and science and math. That's critical. And also, that doesn't carry the day if you can't relate to people and you can't have a substantial relationship with the folks whom you're serving, your patients and your clients. And so that is a big part of this, is students coming out and through this experience feeling competent and confident to engage with people with a diversity of life experience, and being solid in knowing how to form those connections in a way that the students have, and the future providers have, the humility to know that the patients and clients are the ultimate experts in their own lives, and to honor that, and to take our lead from what our folks' needs and goals are, while at the same time having a really keen understanding of how to bring one's emerging clinical expertise and system science expertise into play to bolster and to forward those client identified needs and goals, those patient identified needs and goals.
It seems so beneficial for everyone to be outside of the classroom or the clinical space, getting to know someone and the challenges of transportation or other barriers to even getting to a clinical appointment. And then thinking kind of into a third year in our preceptors, who makes a good partnered patient? What impact do you see on partnered participants, um, providers, community partners, the students themselves?
So not to oversimplify that first question, but the core of it really is someone who wants to engage with students, and who is open to that experience, open to bringing in sort of an additional component to their care team. And then beyond that, it's someone who has challenges to navigating health and social services. And again, frankly, that excludes very few people at the end of the day, because our healthcare system is so, and our social services system is so so complex and not user friendly. Um, but someone who would benefit from some extra hands on deck, and again is open to having those hands and those ears in the form of a student, is really the biggest thing. And then beyond that, from the provider perspective, it's often someone for whom that provider feels like they may not have the time or sort of the logistical capacity within the context of their practice setting to really fully meet the needs and the goals of that individual. And then to answer your second question about the impacts to all of the sort of the parties involved in the partnership, I already spoke a little bit in answer to your last question about the student piece, and really giving students some space for the relational in complement to the more technocratic elements of their training. And for partner participants, definitely the biggest piece is that relational piece, those extra listening ears, especially when we're thinking about marginalized or vulnerabilized communities, which for context, I should say, I work with in my direct practice as well. I'm always struck by just how impactful it is to just actually listen with non-judgment, because people are so used to being either ignored or actively stigmatized, actively hated on. And so just having that warm, supportive presence is in and of itself huge. And then it in turn opens up so many other avenues for the identification and the follow-up of needs and goals. Again, whether those are sort of within the more narrow confines of the healthcare system with respect to accessing care, accessing ancillary healthcare benefits, or whether it's sort of the broader social service context in terms of sort of addressing someone's social determinants and structural drivers of health, and really doing what can be done to sort of get people what they need to live full, stable lives. Um, and we've definitely seen improvements in that year over year from the perspective of the partner participants. And also, an important part of this too is it really emphasizes how that is often incremental, because people are up against so many systemic challenges. And again, I think that in and of itself is a point of learning for the students, that you've got to have stamina and you've got to be able to sit in the mess and work through the mess with people for a long time. You're not going to snap your fingers and make everything perfect for a person. And I think that's important as well. And then lastly, for the community partners and providers, I think it provides just another resource and another tool for them to more fully address the care goals of the folks with whom they're working. And I think that can be affirming and protective against burnout, because again, speaking with my provider hat on for a second, there's nothing more demoralizing than knowing what the person in front of you needs and recognizing that you don't have the time capacity or the logistical capacity to provide it. And so knowing that you're doing that work in concert with someone who's really committed to it and has the bandwidth and the passion for it is really affirming from the provider side as well, I believe.
That provider side really resonates for me as a primary care clinician, thinking about partnered patients and thinking about the students too, and that professional identity of the stamina and the ebbs and flows of busier or less busy times in their clinical training. Are there topics that we didn't touch on that you think are important for us to discuss today?
I think we covered a lot of territory. The one thing that I alluded to, but just want to kind of say explicitly, is for the last 2 years, we've also had this component of the medical students partnering with master social work students from Rhode Island College, and that peer-to-peer interdisciplinary connection comes directly from student feedback. Year over year, we'd heard students say that they really value any opportunity to work across disciplines, and that often that comes as sort of more one-off events, and they really wanted an opportunity to build longitudinal connections with a cross-disciplinary peer. And so that was the catalyst for us building that piece in. And last year, it was really fun to see how the students interacted with one another and how they recognized the strengths and the complementarities of their respective curricula, And the two, at the end of the year, we asked students, what was the most impactful part of the program? And the top two that were vying for the most impactful was the relationship with the partner participant and the relationship with the interdisciplinary peer. So again, that relational piece really, really comes through, whether that's, again, with the person with whom they're working as a patient or client, and also with the fellow student they're partnered with.
It speaks so much to the joy of team-based primary care when there is a social worker and a community health worker and a patient and a clinician. Thank you so much for your time today.
Yes, thanks so much for having me on. This was great.